With the pandemic daunting the world and scaring people, let's get real with the timeline and the challenges for the vaccine to come out. Oxford and AstraZeneca have hinted their vaccine candidate ChAdOx1 could be ready by the year end. Pfizer and its German partner BioNTech have also said they may be on track to approach U.S. drug regulators for approvals as early as October, and they will be in a position to manufacture 100 million doses by year-end and 1.3 billion doses by fall 2021. This is all before any single vaccine has finished Phase 3 of clinical trials, cleared efficacy and safety hurdles and obtained licenses. Depends upon geography, wealth, ability of governments to strike deals with manufacturers and supply chain. Several nations have already signed deals with vaccine manufacturers and makers to get their hands on the first doses being produced. To achieve herd immunity, the world will need nearly 4.7 billion doses. 2 billion doses will be required to cover the healthcare workers and other high-risk groups. First doses will go to healthcare workers, elderly who are most at risk, other high-risk groups in hospitals. After that, it will be distributed among the population, starting with high-risk zones, eventually making it to the last mile. Once the trials theoretically yield results demonstrating a vaccine's efficacy and safety, experts said manufacturing doses should be the easiest part of the whole process. Investments in production capacity have substantially increased. Distribution figures to be an even bigger obstacle. The leading vaccine candidates would have to be shipped and stored at temperatures ranging from -20 to -70 degrees Celsius. These conditions are not readily available at the scale needed. This could be a challenge going forward in terms of distribution. Qualified, trained people will also be needed to help administer the vaccine. Once manufacturing and distribution are complete, people would still not be safe from the disease, experts cautioned. The vaccines are unlikely to protect against shedding. Vaccinated people may still get mild or asymptomatic infections, and thus shed the virus and possibly spread it to others. People who are vaccinated still need to wear masks, and that's going to be a hard message to send. Keeping all these factors in their minds, scientists, along with the support of the movement, are working hard to get a vaccine for this deadly disease out as soon as possible. They are putting in efforts to save us from the pandemic. If you liked our video, don't forget to like, comment, share and subscribe to get great content regularly.